My experience with rheumatic heart disease in Yemen is very painful, as we are seeing too many patients in very devastating state. And I'd like to just see Yemen is in the southern part of the Arab Peninsula, with just to south to the Saudi Arabia, with inhabitants estimated in 2009 to reach 500 million. Rheumatic heart disease is the most common acquired cardiovascular disease among children and young adults in Yemen, and the socioeconomic status of the people is the main factor to determine the prevalence of the disease. Families, medical staff who are dealing with the children are not aware about the disease. The management of the upper respiratory infection in Yemen is usually not adequate, and they don't follow the WHO guidelines. Usually the people are going to the pharmacist and nurses to take their drugs without prescription. Therefore, most of our patients are presenting themselves to the hospitals with symptoms and complications. It's not just undetected because the people are not seeking medical advice. This is a common criteria of the Yemenis. They usually seeking medical advice at the end stage when they can't do their physical activity. And most of the patients are coming either with complication or died at home, and very limited number of them will get surgical intervention. Lack of the data in Yemen is the main issue. No hospital or health center based record of rheumatic heart disease present, and there is no nationwide prevalence of rheumatic heart disease. The prevalence of disease is based on clinical assessment because we are seeing too many patients in our clinical practice. There is a study conducted by Dr. Munibari in 1997 where he found that in Sana'a city the prevalence of the disease was 3.6 per 1,000, which I think it is much higher, but this is his data in Sana'a city alone. Low awareness of the disease in public, families, professionals, and policymakers. The magnitude of the disease is simply not known, and rheumatic heart disease is not being taken as a priority by health authority, despite that 4 successive ministers were cardiologists and 1 of them pediatrician, unfortunately. The burden of the disease is huge on Yemen, and medical care for rheumatic heart disease is very limited in the big cities and almost absent in the rural areas. Rheumatic heart disease presented by one of our colleagues in the World Cardiac Conference in Dubai, and he reported that Yemenis with rheumatic heart disease present themselves very late stage, and this is completely true from our experience in the hospitals. Rheumatic heart disease has been studied by one of our colleagues, Hussein Saleh, in southern part of the country, and they reported that the rheumatic heart disease takes an aggressive course in Yemen with early complication. And he found 51% of the patients presented with moderate to severe lesions, and from those only 34.8% got the chance to valve replacement. Although the disease is common, there is a scanty opportunity to reach the advanced age. The last year, while the country in crisis and almost in civil war, we conducted 42.5% of the total surgery in our cardiac center were valve replacement, and this percent was much higher, and it was reported in WHO report in 2005. It was more than 70% valve replacement. The cost of single valve, because the government is taking a small fee for the patient, it costs around $1,500. The people should pay it for the governmental hospital, and in private hospital, the cost of single valve replacement is around $6,000. And simply this amount of money can't be afforded by most of our patients. So pregnancy, most of the patients with rheumatic heart disease and pregnancy coming too late with complication, and we presented paper in last January in Riyadh. We present our experience in 81 patients present with tight mitral stenosis and pregnancy, and we did for them urgent balloon valvotomy. A repeated abortion because of warfarin, either with atrial fibrillation or with valve, and many patients simply die because of warfarin-related therapy, because most of them are in the top of mountains or away from big cities. Prosthetic valve is another problem in Yemen because most of the patients believe that after surgery their suffering is finished, but actually it started because the compliance to secondary prophylaxis is very poor, and anticoagulation control is very, very low, especially in the rural areas. The compliance for the instruction to come for clinical and echocardiography checkup is not there, and pregnancy with mechanical valve is a big problem in Yemen because ladies believe that if they don't give enough children, the husband will get married again. So even with prosthetic valve, they try again and again and again to get pregnant, and some of them just simply refuse to take warfarin, and the result will come with either death or stuck valve. We have published a paper in Heart Views just in 2010 showing our experience in stuck valve. Stuck valve or mechanical valve dysfunction is still very high in Yemen. The majority of the patients, they don't follow the INR, and they're coming from outside big cities. And more than 90% of these patients, the valve was, they found that thrombus formation, and the mortality among these people, these patients were almost 18%. The access to health service in many parts of the country is poor or absent. Rheumatic heart disease and rheumatic heart fever are not integrated to the primary health service, although we tried several times to do so. Up to now, we didn't succeed. No approved program or enough budget for rheumatic heart disease in the Ministry of Health, and we just had a meeting last month with the Deputy of the Minister, and we asked to write a letter to the Ministry of Finance to give us a separate budget for NCD, especially rheumatic heart disease. There is one governmental center for cardiac surgery for 25 million in Yemen, which is a very long queue, and we can't simply afford to do surgery for all of these patients. Therefore, patients are either dying before reaching the hospital or presenting too late. This is, I have seen it in my private clinic. This is a 24 years old male patient, post-double valve replacement. He's coming in this shape with ejection fraction around 30%. For the next day, I have seen in the hospital this case, which is 27 years old male patient presenting with shock state. I don't know if you can move almost there is no contractility, and he is in rheumatic heart disease. No, this one. No, okay. So he was in very bad condition because they neglected themselves, and they are coming with a very advanced stage. The history of rheumatic fever and rheumatic heart disease control effort, nothing significant has been done so far, but we formulate the national program is there now. We have conducted 5 seminars in 5 different provinces in Yemen, just part of educate the medical staff. Well, the challenges is still very high. We have drawn this cartoon as a logo for our program, which is saying that with single injection you can live with healthy heart. We have written small booklet for the hospital, one for the warfarin anticoagulant follow-up, and the other one just information for the people. Although we have done this, the people usually, they don't read it, and if they don't read it, they don't follow the instruction very much. This is the 5th symposium, Rheumatic Heart Disease, Rheumatic Fever Prevention, conducted in December, or held in December 2010 in Sana'a City. And this is, the program is already prepared by myself with the help of WHO, one expert there, and we hope we just handed over to the Minister of Health this time, and he promised to allocate some money to do something. We hope so. So the prevention program, what we are looking for is to do rheumatic fever, rheumatic heart disease prevention campaign using all means. And we would like to introduce clinics in big hospital. We succeed in 3 hospitals in 3 provinces. A nationwide registry for rheumatic fever, rheumatic heart disease, and the main clinic in each province, and integrated the rheumatic heart disease, rheumatic fever in the primary health service in the whole country, training of the medical staff, and school curriculum. I succeeded to put it in the 4th and 5th primary schools started from this year. Establishment of school clinics for early detection and referral of the positive cases to the clinics in the hospital is one of our goal. Provide enough penicillin injections. Some of people can provide the price of even the single injection, although it is very, very cheap. Provide echocardiogram machine. In Yemen, it is very available. Every cardiologist in his private clinic use the echo machine, and it's available in many hospitals. We need a portable echo machine for field screening. We plan to do the school screening in Sana'a City, and the mayor of Sana'a promised me to support, and next meeting he went back in his word. Maybe he couldn't find enough money for that. Systemic follow-up for the detection of cases needs as long as possible. More cardiac center is needed. Now they are going to open another cardiac center in Aden and one for the military hospital, and there are 2 or 3 private hospitals doing cardiac surgery. We use the Benzathine Penicillin in suspected cases with throat. We recommend our doctor to give the penicillin orally plus the injection at the same time. We use the penicillin in Yemen in every 3 weeks, except high-risk patients. Sometimes some doctors recommend the injection every 2 weeks. We encourage doctors who are dealing with the children to give long-acting penicillin single dose according to the WHO recommendation. Following the patient is very difficult in Yemen. Secondary prevention with benzathine penicillin is a lifelong regimen in Yemen, especially if the carditis and valve affection is there. Secondary prevention must be registered for better follow-up. Usually the patients, especially small kids, are feared from the injection, and the families, the families don't want their children to be injected, and we have to pay more effort and discussion with them to accept that. Professionals fears of anaphylactic shock, because in Yemen sometimes if the patient dies, you will have much trouble with the families and tribe. So challenges of rheumatic fever, rheumatic heart disease, poor awareness in the whole society, including medical staff and policymaker. We need a political will. Up to now, the political will is not there. The low social economic status of the people at the present time is difficult and will not change soon. Absent the medical service in many parts of the country, although we have more than 2,600 health centers in the country, but most of them are not working well. The lack of compliance by patient is another challenges. Poverty, implementation, a national program for rheumatic fever, rheumatic heart disease. What should be done at the present time? Stepwise implementation of a national program, looking for budget, school screening. We have 5 million child in the fundamental school alone, and in the Republic. Preschool, we bought this idea for one of the governorate, and they said it's difficult to force the people to bring their children for preschool screening, although the idea still under discussion. We have to establish and activate the school health clinics, educate the teacher instead of put medical staff there to detect and deal with cases with either positive sore throat or rheumatic heart disease. Provide clinics with echo machine in the whole republic is another things we would like to implement. With we bought four rooms for the rheumatic heart disease clinic, one of them for the injection, with all facilities to resuscitate the patient in case if there is any anaphylactic shock. The whole community should be engaged in Yemen rheumatic heart disease in this program: media, teacher, families, scholars, NGOs, policymakers, and medical staff. The conclusion: rheumatic heart disease and rheumatic fever is still a serious medical problem in Yemen with high morbidity and mortality. No significant intervention has been done so far. Many obstacles prevent making a real progress, including budget and political will. Whole community should be engaged in this. Rheumatic fever and rheumatic heart disease can be prevented and eradicated. Money for prevention is not large as it takes for tertiary hospitals, for instance. People are running for hospitals and cardiac centers, and they don't think, unfortunately, in our region for prevention, and especially in rheumatic heart disease. New generation should be free from the rheumatic heart disease and its fatal sequences. Thank you very much.